Are you a new parent and you're wondering how to choose a formula for your infant? Or do you potentially have an infant with gas or colic or mucousy stools, and are you wondering, could it be their formula? In this episode, we're going to talk about when to switch formulas and how to choose a formula that is tailored specifically to your infant.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
All right, so we're back in the studio at Be Kind Pediatrics. Today we are going to be talking about infant formulas and how we kind of, as pediatricians, specialize or potentially need to specialize our choice of formula to the individual baby. The FDA regulates all formulas, and the reason for that is babies are going to be exclusively on this source of nutrition, and so we want them to grow appropriately. And so formulas are made up of macronutrients, which are going to be proteins, carbohydrates, fats, and then micronutrients, which are going to be your vitamins and minerals. So let's start off with the macronutrient components. And the big one here is going to be the protein source. So this is potentially the most important choice, so let's start with that. Most formulas are going to be cows-based or bovine-based formulas. So when you're looking at the protein source for a formula, there's really two choices, cows or soy. Let's start off with cow. Cow or bovine-based formulas are going to be made up of two different types of proteins. That's whey and casein proteins. And these are the same proteins you actually find in breast milk. So we landed on bovine-based formulas because when formula companies were trying to make formula, they were doing their best and are doing their best to mimic breast milk. Obviously, that's an impossible goal because breast milk is very individual to the person who makes it. But breast milk is made up of casein and whey-based proteins, and so is cows. Breast milk is going to be about, it's going to have much more of a whey component. So it's going to be about 60% whey and 40% casein versus bovine, which is actually the opposite. It's more casein than whey. So it's about 80% casein, 20% whey. And what are the differences between these proteins? So casein proteins and whey proteins act differently when they're in an acidic environment. So your gut and your stomach specifically are acidic environments. Whey, when it's in an acid-based environment like your stomach, remains soluble, meaning it dissolves into water, versus casein-based proteins, when they're in an acidic environment like your stomach, tend to form a coagulated compound. And so I don't know if you've ever noticed, but when you burp a breastfed baby, sometimes that white curdled material comes up, and that's the casein formula. The importance of this is really twofold. One, casein has delayed gastric emptying, so it sits longer in the stomach than whey proteins. And two, some babies who are going to have either an intolerance to a protein or a true allergy to protein, the most likely thing that they are going to be allergic to in a formula is the protein. And between whey and casein, it's more likely statistically to be the casein part of the formula. So I recommend for most babies, especially babies who are spitting up a lot or seem to be having a lot of gas or are fussy, that the first thing you can do is consider looking for a formula that has a more similar whey casein ratio to breast milk. And the way that you're going to be able to tell that is just by looking at the ingredients. To make that ratio similar, they have to add whey concentrate back into the formula. So if you look at the ingredient label, it should say whey concentrate on it. Let's kind of move on and talk about soy formulas because that's the other protein choice. So I really hardly ever, and I actually can't think of an event that I would recommend a soy formula. But if a family is vegan and they're really committed to that, I respect their choice to choose a soy formula, but it's not something I would recommend right off the bat for anyone in particular. And there are a few patients who I say absolutely shouldn't have soy formulas. So the two that should not have it are patients who have a true cow's milk protein allergy. There's so much cross-reactivity between cow's milk and soy, it's not recommended to move to a soy-based formula. And we'll talk about what kind of formula they should receive. I also don't recommend soy-based formulas to preemies. And the reason for that is because it is a vegan-based protein, it needs to go through extensive processing to increase the bioavailability such that it meets the nutrient needs of a baby. Additionally, it needs to have a ton of micronutrients added back in. And preemies just have such a high micronutrient need, and it needs to be very specific to meet their needs, that they should never be on a soy-based formula. Two more things I'd like to talk about with soy. So soy can be a good choice for a baby who truly needs a lactose-free formula. So those are going to be babies who are born with extremely rare hereditary deficiencies in lactose, or who have a rare disease called galactosemia. And so those are two types of babies who might need to be on a soy-based formula. And the last thing I want to talk about is a lot of patients ask me about the estronizing effects of potentially soy-based formulas. So there is some research out there that there are some phytoestrogen effects of soy-based formula, but there's not so much evidence that we feel that it's not safe for male or female infants. But just be aware that there are kind of some studies that show long-term, potentially estrogenizing effects of soy-based formulas. Let's move on to the next big macronutrient, and that, since we were talking about lactose, is actually going to be lactose. So again, human breast milk, the main carbohydrate source is lactose, and that is going to be the same for most formulas. There are some formulas out there that use other carbohydrate sources, and we'll talk a little bit about those. If you're not using lactose for your carbohydrate, you're going to see that they are using either corn syrup solids, rice syrups, or sucrose as their alternative carbohydrates. And why might a baby need to be switched from a lactose formula to a lactose-free formula? There's a few reasons. So one, again, a true lactose deficiency, which is, again, very rare and often hereditary. A premature or late premature baby, so lactase is the enzyme that breaks down lactose. And if you think of your gut as a tube, inside that tube you have things projecting out like fingers called villi. And lactase is an enzyme that's made at the very tip of your finger or the very distal tip of the villi. And the expression of lactase really increases around 38 weeks. So prior to 38 weeks, most infants don't have a ton of lactase expression, meaning they don't have the enzyme to break down lactose. So preemie formulas, for example, are lactose free because the babies just don't have the ability to break down lactose yet because they don't have lactase. So a late preterm infant, and that can be anything after 38 or before 38 weeks, so 37, 35 weekers, they may benefit from a lactose-free formula. But just be aware, again, that carbohydrate then is going to be some sort of either corn syrup solid, rice syrup, or sucrose as their main carbohydrate. So they might need a lactose-free formula. Sometimes after any inflammation in the gut, so like a gastrointestinal virus, some sort of stomach bug, babies who were recently diagnosed with an allergy, especially after the introduction of solids, or babies with celiac disease, again, IBD causing any inflammation in the small intestine, the gut, is going to cause those villi, those projections, to become inflamed and slough off. And so they will have a temporary lactose deficiency. And so for a period of time, those babies may benefit from a lactose-free formula. So what does that look like after a GI bug? It might be a baby who was previously doing really well on their infant formula, and all of a sudden they're having a ton of spit up, a lot of gas, super mucousy diarrhea, or persistent diarrhea. They may benefit to going to a lactose-free formula for a few weeks while their gut recovers and heals, those villi heal, and the lactase enzyme is able to be expressed again. So the next major macronutrient that we're going to talk about is the fat source. So in the US, all infant formulas, their main fat source is going to be some sort of vegetable oil blend. And the one that I see parents getting the most concerned about is palm oil. So why did formula companies choose palm oil to begin with? They chose palm oil because palm oil contains palmitic acid, which is essential and required as the same acid that is in breast milk. The palmolic acid in the form of palm oil specifically, it does form little calcium soaps in the belly, which can reduce the absorption of calcium as well as fats. So formula has more calcium and fat in it to account for that. It's totally safe. Really, the only side effect that we see from palm oil is it potentially can cause harder stools. So if you have a baby who's really having true constipation, they're really struggling with it, it might be, you might consider using a formula that omits palm oil as their source of fat. One other fat to talk about that can be available in different formulas, MCT oil. So MCT oil is a great choice for especially premature babies or babies who are having a hard time gaining weight, babies with short gut. And the reason for that is MCT oil, or medium chain triglycerides, are easily absorbed. They're high in calories and they don't require a lot of energy to be broken down, and they are absorbed higher up in the gut. So again, babies with short gut, babies with problems with their small intestines, babies who don't or cannot afford to expend a lot of energy breaking down food and who need those extra calories, MCT oil can be a great source of extra fat and calories for those infants. The other two that get a lot of press are DHA, RHA. So DHA has been kind of extensively studied. There are several Cochrane reviews on this. It's been shown to have little or possibly no benefit. Specifically in preemies, they looked at DHA supplementation and found that while it did confer a small increase in possible IQ points, there was also a slight increase in specifically in the premature infants of development of BPD or bronchopulmonary dysplasia. So there were some risks associated for those premature infants with DHA supplementation, but it is found in breast milk. Again, the amount in breast milk is highly variable. It depends highly on the individual mom's breast milk and maternal diet. Interestingly, the European Commission has now come out and stated that they're going to require DHA and RHA to be in all of their infant formulas. So it's definitely available. There are formulas available in the US that contain these two fats. So now I want to go back and talk about proteins again for a little bit, because we talked about that there's two different types of proteins available. That's going to be bovine cow protein or soy protein. But the way that the protein is delivered can vary. So when babies have, I said, an allergy, the most likely thing they will be allergic to in a formula is going to be the protein. And between the protein, the two that you're most likely to have an allergy to is the casein protein. And so there are different, when you break a protein down, you can what's called hydrolyze it and break it down into smaller pieces. The absolute smallest piece being the elemental formulas, or the totally hydrolyzed, also known as amino acids. So if you take a big long protein and break it down into its smallest parts are its amino acids. And there's a spectrum of how much you can break it down for formulas. So you can go from a full protein formula, or also called an intact protein formula, to a partially hydrolyzed formula where it's broken down a little bit more, to an extensively hydrolyzed formula where it's broken down a little bit even more than that, to a completely hydrolyzed or amino acid or elemental formula. And so there's different types of babies who benefit from different amounts of this breakdown. So let's start with going from intact to partially hydrolyzed. So in the US, partially hydrolyzed formulas all are going to use a little bit of a different carbohydrate. So none of them are going to use full lactose. They're all going to have a component of the corn solid syrups or rice syrups or sucrose. So just to know that when you go from a intact protein formula to a partially hydrolyzed formula, you are going to introduce some of that corn syrup solids into the diet. So who can benefit from a partially hydrolyzed formula? Babies who can benefit from that are, again, likely some of those late preterm babies, because when you look at the protein composition of breast milk, it is a little bit more broken up. And so sometimes those late preterm babies can do a little bit better with a partially broken up formula like that. There is some research that suggests babies, specifically babies with eczema, may do better on a partially hydrolyzed formula. So often if I have a baby who presents with either moderate to severe eczema or we're having a hard time controlling their eczema, I will recommend a trial of switching to a partially hydrolyzed formula and seeing if we get some better control and less flares. Babies with cow's milk sensitivity. So these are not cow's milk allergic babies. Cow's milk allergic babies have blood in their stool. They have problems with their growth and weight gain, that is a totally different disease. So cow's milk protein allergy is different than a cow's milk protein sensitivity. Cow's milk protein sensitivity might look like a rash, again, spitting up more, having loose mucousy diarrhea, increased gas. Those are all signs of a potential sensitivity, and those babies may do better with a protein that's a little bit more broken up, like a hydrolyzed formula. I also will sometimes recommend babies with colic, that we look at if part of the reason that they're colicky is that they're having a hard time with digestion. And so if they're on a formula, I will recommend a trial to a partially hydrolyzed formula to see if that improves their digestion. So next breakdown, we're going to go from the partially hydrolyzed to the extensively hydrolyzed. These are going to be broken down slightly more than the partially hydrolyzed formula. These are good for babies who need a lactose-free option because all of these formulas do not contain lactose. So again, those are going to be the babies who have true hereditary lactose deficiency, or the babies who have something like lactosemia where they require a formula that contains no lactose. The next step down is a fully hydrolyzed formula, also called an elemental formula. This is where the protein is broken down to the smallest components called amino acids. These formulas are very useful for babies who, again, have really hard time with digestion. So that's going to be babies with something like short gut, or babies who have a cow's milk protein allergy. So those are going to be babies who, when they had cow's milk protein, they have either blood in their stool, they have bloody spit up, they have failure to thrive, poor weight gain. Those babies are going to be switched to an elemental formula. The other area of research that was kind of interesting is they did recently publish a study where they looked at the first 3 days of life specifically, and randomized babies to either receiving an elemental formula or receiving a full intact formula for those first 3 days of life. And then they looked at the development of IgG sensitivity to cow's milk, and then furthermore, did those patients with IgG sensitivity have a true cow's milk allergy? And what they found was babies who were introduced to intact cow's milk protein had about a 13% risk of developing a cow's milk protein allergy. Babies who had elemental formula or cow's milk proteins that were broken down into the smallest parts only had a 3% risk, giving them a number needed to treat of about 7. So what this tells me, or kind of what we theorize, is that the newborn gut in the first 3 days is really sensitive, and potentially having a elemental formula or a fully hydrolyzed formula in those first 3 days may reduce the risk of developing cow's milk protein allergy down the road. So this might be another area where a fully hydrolyzed or elemental formula may be helpful, is just in those first 3 days of life. The downsides to all the hydrolyzed formulas, specifically the amino acid or elemental formulas, is they are very expensive. So we try to use them only when we really need them. They can kind of have a poor taste and have a bad smell. So sometimes families also don't particularly like that side effect. But when you need them, they can be truly life-saving, especially for those babies with cow's milk protein allergies or babies with digestive issues such as short gut. What was interesting about, and what I'd like to see more about with that study I was talking about with the cow's milk protein allergy and the elemental formulas, is could we potentially use a less hydrolyzed formula? So could we use a partially hydrolyzed or even extensively hydrolyzed and see the same results? And how long do we really need to use the formula? So is it just for the first 24 hours, 48 versus 3 days? I think all of those areas are areas that would be interesting to see where the research goes, so that we can further tailor those recommendations within the first 3 days of life for formula. And now I kind of just want to finish up and wrap up by talking about other formulas that I commonly get questions about. So I frequently get questions about, are there any other sources for protein other than bovine cow or soy? So particularly a lot of families ask about goat-based protein formulas. So there are no goat formulas in the US that are approved for infant use. There is one brand, I think, of goat formula that's FDA approved for toddlers. And I want to take a special moment to actually pause here and talk about toddler formula. So you should be aware, if you're using infant formula, that there is something called toddler formulas out there. They're often marketed and kept in the same area of grocery stores. and they look very similar to infant formulas. But they are not infant formulas, and it's very, very important not to use a toddler formula for your infant for many reasons. Infants have immature kidneys, and so they cannot tolerate the same level of protein as well as micro or macronutrients. And so they can quickly have too high of a solute load, which can lead to renal damage, or they can get toxicities from the micronutrients like the minerals and vitamins, for example. Too much vitamin D, too much calcium, too much iron. These can all cause life-threatening complications. So very important to make sure you're using an infant formula and not a toddler formula. And we're talking about goat formula here. Again, there is no infant FDA-approved goat formula in the US. There is only one toddler-approved formula. And the reason for that is because goat milk specifically has a very high amount of protein compared to breast milk. So most infants cannot tolerate, their kidneys cannot tolerate that much protein. The second one I get a lot of questions about is homemade formulas. So again, kind of like we were just talking about with the goat milk proteins, homemade formulas can be extremely risky to make. I never recommend that you make a homemade formula at home. Part of the reason, besides the risk involved, is that when you're making a formula, we talked about, there's macronutrients, but then there's also these micronutrients, which are your trace elements, minerals and vitamins. Minerals and vitamins in the US are not FDA regulated, they're over the counter. And so the exact amount that you're getting is hard to predict with an over the counter substance. And so you are kind of being set up to not succeed as a parent when you're making your own formula, because you don't know exactly how much of that micronutrient you're adding back in. And like I just was talking about, calcium, vitamin D, iron, all of these things, either too much or too little, can lead to anemia, bleeding. It can lead to poor cognitive outcomes, rickets, poor bone development, or specifically with iron toxicity, which can again be life-threatening. I really strongly recommend that you do not try or attempt to make your own homemade formula for those reasons, because just from the get-go, you're not really set up to have a successful outcome. And the last kind of formula topic I want to touch on before we close out this episode is formula storage. So if you are using formula, the powdered mix, from the time that you mix it to the time that it needs to be used, even if it's put in the refrigerator, is 24 hours. From the time that you heat it up or feed it, it needs to be used within 2 hours. And I especially kind of make this point to parents who are mixing formula with their breast milk. If you mix formula with your breast milk, you go by the formula storage guidelines. And so I really recommend, since breast milk is so precious, that if you are going to mix formula with your breast milk, store them separately and mix it just before use. So don't pre-mix your bottles for the day ahead of time with your breast milk in case you don't get to use them all. And the reason that the storage guidelines are so much tighter around formula is, again, this is a very micro and macronutrient rich substance, and it's very prone to bacterial growth because of how nutrient rich and dense it is. So you want to be very careful to follow those guidelines carefully, especially if you have an infant who is premature or has an immunodeficiency or chronic disease. Be even more strict with your storage guidelines. And then just another note on that, since we're talking about babies who are premature or potentially have immunodeficiencies, there is a slight difference between formula that is powder-based and formula that is pre-mixed or ready to use. The ready-to-use pre-mixed formula has a theoretical decrease, is slightly more sterile, so has a little bit of a decreased risk of having a bacterial contaminant in it. So that is another consideration. If you have a baby who's really premature, who has chronic disease or has immunodeficiency, you might opt for a pre-mixed formula because of that decreased risk for contamination. So that was a ton of information about formula. I hope you found it helpful. If you have any questions or comments, please leave them below. And I hope you find this information helpful.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.